dad name is Muniyappa. He had a MND, motor neuron disease, COPD, respiratory failure. 2 times he went on the ventilator tube. After going on ventilator, they told that there is no hope about the patient. Last time when he went on the ventilator tube, we confirmed that he is no more. We came to know about the Nightingales team. Then we called to the madam and we met Moksha madam, and they started service from the hospital only.
Mr. Muniyappa, he was advised for ICU at home in view of his clinical condition and comorbidities. As per his clinical requirement, we set up a mini ICU at his home. Initially, Mr. Muniyappa was depressed. Homely environment along with his family support improved his clinical condition. In traditional ICU setup, patient gets disconnected with his family, whereas in home setup, he gets the privilege to be with the family, which promotes for a better healing.
After we went to the second checkup, it came to 55% and doctor told that you have done a very good achievement. He got a 55% heart improvement. So he told that you are great, you peoples are great. I told that credit goes to Nightingales. They are taking care of so nicely about my dad. I am really very grateful, thanks to Nightingales team members. Because of your Nightingales only, today my dad is able to sit, he can swallow, he can do whatever, he can speak, he will tell everything. Because of Nightingales, my dad is alive.